Trematode. Trematode, the examples are, trematodes are also called as flukes. It could be blood fluke, that is cystosoma, liver fluke, fasciola hepatica, GI fluke, fascioliopsis buski, liver fluke. Other examples are also there, Opisthorchis and Clonorchis. Clonorchis and Opisthorchis, they are also liver fluke. Fasciola, also liver fluke. Fascioliopsis buski, intestinal fluke, and lung fluke is Paragonimus. Paragonimus. Coming to the manifestations. Manifestation, they say that cystosoma, hematobium, it causes squamous cell carcinoma of bladder. Cystosoma mansoni and japonicum. Japonicum, they cause two important hypersensitivity reaction. They say that they cause a cutaneous type 1 hypersensitivity reaction called as cercarial dermatitis. Or swimmer's itch. The same time they cause a hypersensitivity type 3 kind of serum sickness kind of infection called as Katayama fever. So these are the important manifestations. Apart from that, they can cause dysentery also. Liver fluke, Fasciola hepatica, can cause hepatomegaly, liver enlargement. Clonorchis and Opisthorchis can cause CA bile duct. CA bile duct. Fascioliopsis buski is a GI fluke, so you will have all sort of intestinal manifestation. And Paragonimus westermanni, it is the agent of endemic hemoptysis. It is present, it is endemic in Manipur, endemic hemoptysis, and it is particularly endemic in Manipur. Okay. So let us discuss now life cycle. So this is in general their manifestations. Now let us focus on their life cycle. In general, the life cycle of trematodes is like this. They say that they have three hosts. Man is the definitive host. Whereas intermediate host, the first intermediate host is snail. The second intermediate host is aquatic plant for F. How many of them have F? F for Fasciola and Fascioliopsis. Whereas second intermediate host is fish for Paragonimus, Clonorchis and Opisthochis, crayfish or crayfish. What is remaining? Schistosoma. Schistosoma, there is no second intermediate host. The infective form is metacercarial larva for all except schistosome, where the infective form is cercarial larva. Similarly, mode of transmission, they say that ingestion of second intermediate host is the most common mode of transmission seen in most of the trematode, except, which is exception, schistosome. Here the mode of transmission is skin penetration by cercarial larva. Okay, so this is how the life cycle you have to remember, and they say that the diagnostic form is egg. Only thing is the specimen is the specimen is different. For example, Schistosoma hematobium, egg is detected in urine, whereas Paragonimus in sputum, whereas most other trematode it is detected in feces. The specimen is different, otherwise egg in sputum is the most diagnostic form. The description of egg is all trematode they have operculated egg. Operculated egg in most of the trematode except Schistosoma. Schistosoma, the eggs are non-operculated. Instead of operculum they have a spine, and based on the spine you can locate, based on the spine you can locate. For example, Schistosoma hematobium has a terminal spine. Hematobium has a terminal spine. Mansoni has a lateral spine. And Japonicum has a rudimentary lateral spine. Rudimentary lateral spine. So this is how you have to speciate. This is how the three important Schistosoma species can be differentiated from each other. Drug of choice for all trematode infection, the drug of choice is praziquantel. Except Fasciola hepatica, where the drug of choice is albendazole. Okay, so this is all about